And that's Dr. Mwesi there. Meanwhile, the Ghana Health Service has described as untrue claims that Sputnik and the AstraZeneca vaccines are not as effective as others against the Delta strain of COVID-19, predominantly in India and now detected in Ghana. Head of the West Africa Center for Cell Biology and Infectious Pathogens, WACPIP, Professor Gordon Awandere, earlier told Joy News the two vaccines are not the most effective against the new strains. Listen.
Now we have to be looking at the right vaccines. We all this while we've been, fixed on, AstraZeneca and Sputnik V. We have to start shifting towards looking for, more of Pfizer and others, which have a better chance of protecting against these variants. Because the future is these aggressive variants. That's where we are going. The UK strain would probably recede soon. It will be replaced by some of these new variants.
With the nature of the virus as we know it, there are new variants coming out every few months. So does that mean that we are going to have to vaccinate ourselves again when, there's another strain in the system that is different from what Johnson & Johnson and Pfizer can fight?
Yes, that's the reality, that this may be similar to the flu, that every year or every few years we have to adjust the vaccine to suit the prevailing strains. And so that's why local manufacturing and vaccine development is important. We need to start making serious progress.
And that's Professor Awandere there speaking to my colleague Daniel Darcy. Well, the Ghana Health Service has issued a statement on the matter. I'm going to share details of that with you. Here it is. It says that COVID-19 deadly strain detected in Ghana, Sputnik V, AstraZeneca vaccines not effective against it. So that's a response to it. It says the Ministry of Health and the Ghana Health Service take note of a publication by myjoyonline.com on 21st of June 2021. The headline COVID-19. It goes on with the headline there. It says the service hereby informs the general public that 1, all passengers who test positive at the Kotoka International Airport are put under mandatory isolation. Number 2, all positive samples are sent for further testing. That's genome sequencing to identify the variant. Variant sequence from samples of positive cases at the airport, quote, do not, and it's boldened, do not necessarily end up in the community. So it doesn't say that it hasn't been detected. It says when it is detected at the airport, it does not necessarily end up in the community. Number 4, it says as of now, the country has detected 6 Delta variant of the SARS-CoV-2 virus from all samples taken between April and June 2021 at the ports of entry. No Delta variant has been detected from samples taken from cases in the community, and you need to take a close look at the 4th point. It says as of now, the country has indeed detected 6 Delta variant of the virus from the samples taken between April and June, but the same variants have not been detected in the community except at the airport. Now, the MOH, as the Ministry of Health and the Ghana Health Service, further informed the general public that in April 2021, there was a surge in cases at the airport, during which period 308 positives were identified. However, Ghana has not experienced a 3rd wave, partly due to the robust surveillance system in place at the ports of entry and strict isolation of all cases detected. So let's quickly move to the last but one paragraph. It says that a study conducted by Gamaleya Center suggests that Sputnik V is more effective against the Delta variant of coronavirus first detected in India compared to other COVID-19 vaccines. It must be noted that in the midst of global supply shortages, the Ministry of Health and the Ghana Health Service are diligently working with government to ensure that adequate vaccines are procured to protect the population. The MOH and GHS and the Food and Drugs Authority are working collaboratively to ensure that vaccines that come into the country are safe and effective. Finally, the statement says the service would like to urge Ghanaians to take advantage of vaccination when their turn is due, while entreating the general public to adhere to COVID-19 prevention protocols, i.e. wearing of face masks, practicing of hand hygiene and physical distancing as part of the strategy. So note that the point it makes in this statement is they Sputnik V is more effective to when it comes to dealing with this variant that's coming from India. It does not mention AstraZeneca, which is one of the vaccines as well, which was mentioned as not being effective against the Indian strain.